Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Are you looking for a company that empowers your growth and development? Look no further than the Elements Massage brand, where all massage therapists have the opportunity to thrive through the Elements Massage Career Advancement Program. In the Elements Massage Career Advancement Program, Elements Massage Studios recognize, reward, and uplift their massage therapists, rewarding continuous learning, commitment, and growth. The Elements Massage Career Advancement Program includes professional, elite, and master levels, where massage therapists will enjoy higher commission rates, access to continuing education and development opportunities, and unique career growth opportunities to propel them toward a successful future. Evaluate your career and apply to an Elements Massage studio today. Visit elementsmassage.com/careers and take the first step towards a fulfilling journey. That's elementsmassage.com/careers. The American Massage Conference, produced by Massage Therapy Media, is back. The AMC is coming to the Holiday Inn, Disney Springs, Orlando, May 16th through 18th, 2025. The event kicks off with Free Friday, where you get to listen to lectures and participate in interactive demonstrations and masterminds with educators from Canada and the United States. The rest of the weekend is jam-packed with courses and a bustling trade show. Check out massagetherapymedia.com/conferences for the conference presale and secure your spot.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Today's I Have a Client Who brings up an interesting decision-making process, and it introduces a whole new player into the do-your-own-research world. What does AI have to say about massage? And what do we do when our clients trust it, but maybe we do not? As you might imagine, I have some opinions about this, and I am excited to share them with you. But first, here's our story. Hi, Ruth. I have a regular client who underwent a TAVR, transaortic valve replacement, 2 weeks ago. I normally see her every 2 weeks, but had not set up for her massage this week due to her surgery, and because in school I was taught that after most any surgery you should wait 6 to 8 weeks for massage. Well, she inquired today about an appointment, and I told her it was too soon. We had been discussing waiting 6 to 8 weeks. She told me she, quote, looked it up, and it's okay to have massage after 3 days. I Googled, how long after heart surgery should I wait to have a massage, just to see what she might be seeing? And at the top of the list was a vague AI-generated summary stating that it is okay to have massage on day 3 after surgery. When I dove deeper and skimmed through some of the articles and scientific studies that followed the AI summary, I saw that there were studies talking about massage on day 3 after surgery, but these people were still in hospital. And there was a supervised protocol, and they were not getting an hour of full-body Swedish or deep tissue. Most of it talked about hand massage or foot massage or seated shoulder massage for 20 minutes. I know that surgical techniques have advanced, but I've only been out of school for 12 years. Have things changed that much? I still base my work on the 6 to 8 week waiting period, and that is what I'm comfortable with. I have no problem discussing this with my client, but I'm curious for your thoughts on 2 things. Number 1, is it still a common teaching to wait 6 to 8 weeks after surgery? And number 2, what do we do with bad information generated by an AI summary? Thanks for your expertise. Oh, my friends, we are going to have some fun with this one. At the heart of it really, though, is the unanswerable question, what is massage? And we'll get back to that. But first, let's look at this surgical procedure. Transcatheter aortic valve replacement, TAVR, is sometimes known as transcatheter aortic valve implantation, or TAVI. And this is a procedure that works to replace a damaged aortic valve, all by way of the femoral artery and the aorta instead of via open heart surgery, which is how it used to be done. But let's back up one step and talk about heart valves. You might remember that the heart has 4 valves, 2 that separate the atria from the ventricles, that's the tricuspid on the right and the bicuspid or mitral valve on the left for you heart valve nerds. And there are 2 more valves that separate the ventricles from the arteries that they empty into. So that's the pulmonary valve on the right, leading to the pulmonary artery, which takes blood into the lungs, and the aortic valve on the left side of the heart, which of course leads into the aorta and the entire rest of the body. Think of these valves as one-way swinging doors. Their goal is to allow blood to flow only in one direction and to prevent backflow, or regurgitation, as it's called in this case. And it's a really important job because if blood doesn't flow quickly and predictably through these heart valves and on into the appropriate arteries, it can thicken and pool and create clots, and that's really dangerous. Several things can affect the health of the valves. Infections, congenital weaknesses, some genetic diseases can all weaken heart valves. But for most people, a weakened, stenosed, stiff aortic valve is probably part of a whole heart disease scenario with atherosclerosis and hypertension, all as part of that picture. A weak aortic valve doesn't always produce dramatic symptoms, especially early on, but as it gets worse, a person might have chest pain, shortness of breath, fatigue, lightheadedness, fainting. They may have palpitations, and their heart sounds will be irregular. A person with this combination of problems is a setup for some serious consequences. This heart may push out clots that could end up in the coronary artery or in the brain, that's heart attack and stroke. Or their heart could simply wear out, getting larger but weaker over time, that's cardiomegaly and heart failure. What can we do with a weakened aortic valve that doesn't open all the way and makes the heart work extra hard? Well, we can replace it. And now we can replace it without massively invasive surgery by threading an instrument up the femoral artery upstream through the abdominal and thoracic aorta and finally reaching that aortic valve. Then a new valve, often made from a pig or a cow's heart valve, along with a metal framework, is installed. The catheter is withdrawn. The whole process takes about 2 hours. TAVR offers a lot of advantages. It is so much less invasive than open heart surgery. So there's a shorter hospital stay, there's much faster recovery time, fewer and less threatening complications, and patients are usually up and walking on the same day as their procedure. That said, it is not without risks. There can be collateral tissue damage. The person might end up needing a pacemaker, or an aorta repair, or some other kind of follow-up surgery. TAVR is not the right choice for everybody, obviously, but it's clearly safer than surgical aortic valve replacement, or SAVR. That's a procedure that requires that we cut the chest open and take the heart out to do it. We do about 72,000 TAVR surgeries each year in this country. The cool thing about TAVR is that rehab, in the form of working toward restoring full physical function, can begin on the same day as the procedure, when patients are encouraged to be up and walking around. Some sources say the typical TAVR hospital stay is 4 to 6 days. Other sources suggest that 1 to 3 days is adequate. We do see that longer stays, presumably because of post-surgical complications, lead to poorer outcomes overall. After a patient is discharged, they will typically be referred to some kind of cardiac rehabilitation program. That is, an exercise program that's designed to gently bring their heart back to full strength. Most resources suggest that it takes about 4 to 10 weeks to accomplish this goal. And now we get to the really interesting question: when is it appropriate to incorporate massage into this process? As we said at the beginning, it all comes down to what we mean by the term massage. This contributor's client had surgery 2 weeks ago, and we don't know any more than this. Let's suppose, in the absence of more information, that she had a TAVR because of heart disease and not because of a congenital problem or some other issue with the function of her aortic valve. Let's also assume that she is still under the care of her healthcare team. So we are likely to be talking about someone who's probably feeling a lot better than she did before her surgery in terms of fatigue and shortness of breath and faintness, and that is a big win. But she's probably not up to running any half marathons anytime soon. Nonetheless, she is eager to receive massage as soon as possible, and she has Googled some information that seems to support this point of view. Meanwhile, our contributor's education suggests that it is much too soon. Our contributor wisely looked into what the client found online, and here's what they said. When I dove deeper and skimmed through some of the articles and scientific studies that followed the AI summary, I saw that they were studies talking about massage on day 3 after surgery, but these people were still in the hospital, and there was a supervised protocol, and they weren't doing an hour of full-body Swedish or deep tissue. Most of it talked about hand or foot massage or seated shoulder massage for about 20 minutes. Ruth again. I concur with this completely. In the early 2010s, there was a big surge in research, much of it connected to the Mayo Clinic, looking at possible benefits of massage for people undergoing cardiac surgeries of various types. And as our contributor found, much of this was carefully adjusted to be appropriate for inpatient use, not full-body 60-minute Swedish or deep tissue massage. And, by the way, most of those research findings were strongly positive. People who received this kind of bodywork had less pain, less anxiety, less muscle tension, and they reported much greater satisfaction with their overall experience compared to people who didn't receive massage. But when the client uses the word massage and the Google AI tool uses the word massage, clearly they are not talking about the same thing. And ultimately, it will become the job of the practitioner to explain those differences and to work with the client to figure out what can happen in a session that will keep her both safe and happy. I want to say a few more things about using AI to filter information before we move on to talking about how this therapist can be helpful. If you know my work, you may also know that I regularly state my policy that nothing that I write or use in a podcast or in a class has been generated by artificial intelligence. My words in this podcast, and all of them, are my own, unless I specifically say something like, here's what the Cleveland Clinic says, or here's what our contributor wrote. However, I have started to use AI, specifically a free version called Perplexity that Whitney Lowe turned me onto. That's available at perplexity.ai. And I don't use it to answer questions. Rather, I use it as a starting place to gather good information sources. Because one of the things I really like about Perplexity is that it cites all of its declarative sentences and it provides direct links to those resources. And when those resources are hospital systems, branches of the NIH, or something published in a peer-reviewed journal, then I will look there for the key information that I'm looking for. However, when the sources are product manufacturers or self-promoting blog posts, then I know that they are probably not the information that I want to trust without some more backup. I have, on occasion, just for fun, looked up things like what are safety guidelines for massage and Guillain-Barré syndrome. That's a fairly obscure autoimmune situation that not many people have written about. And I have found my own articles in the list of perplexity citations. And that's how I know this important bit of information. Sometimes the AI machine misquotes me. And if it's happening to me, it's happening to other resources too, which is why I say, go ahead and start with an AI engine, but don't stop there. Use it to get primary resources and then go to those resources to get the information from the people who provided it in the first place, and that's how you can avoid some pretty serious missteps. Okay, that's enough of that soapbox for now. Let's return to our contributor and their questions and what they might be able to provide for this person who recently had a TAVR procedure. Remember, our contributor says, in school, I was taught that after most any surgery, you should wait 6 to 8 weeks for massage. And again, in response, I ask, well, what's massage? In the introduction to this podcast, every time it airs, I say, we almost always have something good to offer if we can figure out a way to do that safely, effectively, and within our scope of practice. And I stand by that in this case as well. Our work has lots of benefits to offer this client all the way along her recovery process. She might need some really gorgeous focused work on some part of the body that doesn't put any kind of strain on her cardiovascular system, and using some technique that doesn't put her at risk for exacerbating side effects of her medications. I love the construction of the upper back and the tops of the shoulders because if we stay away from the lateral neck, we can do amazing pain-relieving work without putting someone at risk for cardiovascular stress or blood clotting. Low backs are the same. We can massage the scalp, the hands, the feet, and make someone feel like they are in heaven, all without challenging the cardiovascular system or running into problems with medications. Maybe sessions need to be shorter to start with. Maybe they need a different kind of pressure, all depending on her resilience and her tolerance. That's a decision that our contributor can make with their client. But when do we know when to take it a little further than that? How do we know when it's time to crank things up a bit? Well, one way to find out is to see what she's doing in her cardiac rehab program. If she's being encouraged to break a sweat and work hard to do her exercise and then go just a bit harder, well, we're probably on safe ground with most kinds of massage. Are we not sure about where those boundaries really are? Then it might be time to ask her permission to have a conversation with her physical therapist or her occupational therapist or whoever it is that she's working with. Be prepared to describe her goals and your massage and your specific questions or concerns about that. Here's a bit more of what I learned as I re-looked at massage for cardiac patients. And all of these are in our resource list within the show notes. One study, authored by Pressler et al., enrolled some post-TAVR patients in an 8-week program of endurance and resistance training. Compared to usual care, the patients in that program showed improved exercise capacity, muscular strength, and quality of life during that 8 weeks. People who have been through cardiac surgery of any kind are at increased risk of depression. This can interfere with their mood state, of course, but it also influences how well people take care of themselves, and that has long-term repercussions for their health. We know that welcomed touch and healthy social contact are great for depression, so that's another place our work can be helpful. And lastly, although there are other articles listed in our bibliography, I want to just highlight a cute little systematic review by Grafton Clark et al. They looked at 7 different studies about massage therapy after cardiac surgery, and they found consistently positive reports for anxiety and pain relief, but they did not find that researchers tracked post-surgical pain relief drug use to demonstrate a reduced use. That is indeed frustrating, but you know what's more frustrating? That based on this observation in a great number of 7 studies, they conclude that it makes no sense to recommend massage in this situation. Yeah, okay. That's not biased at all. So overall, Graft and Clark notwithstanding, here's my conclusion. There's a way to offer something good for this client, but it probably is not going to look like the standard full-body Swedish or deep tissue massage that she was getting before her surgery, at least not for a while. I think it's great that this client wants to receive massage as she recovers. I think it's wonderful that this massage therapist wants to do that safely. And best of all, both of them can have what they want. Hooray!